If you got you to an ideal dose, let's say you're targeting 60 or you're targeting 80, you got to that dose. Remember, I said that the level of vitamin D is genetically predetermined how much your body makes. So what happens if you stop at vitamin D? You're going to drop back to that low level again. And then they're like, oh, I wonder why it's low again. Hey, everybody. Maggie UMD here, functional and holistic medicine physician, here with my sidekick.
Hi guys, I am one of the members of the social media team. So we're the ones that are interacting with you guys, seeing your posts. We love all your questions. Honestly, I learn a ton from you guys. So I love seeing you guys interact here, and I like that a lot of you are going to get some questions answered.
We're celebrating National Autoimmune Disease Awareness Month. And today we're going to be all about supplements. As a conventionally trained MD at one of the top medical schools in the country, UCLA, practicing as a family medicine physician for the first 10 years of my career. Then I got sick, mystery illness like crazy, and ended up being diagnosed with an autoimmune disease and many mystery autoimmune symptoms as well. So Hashimoto's, fibromyalgia, ADHD, C. diff infection. We can go on and on. These are just patterns in autoimmunity, right? But what I've learned is with all my conventional regular medicine training and all my functional medicine training, which is natural medicine, that's data driven, when you combine the two, I realized that as a conventional doc, you got tools which are really limited, which is medication or procedure. But as a functional medicine doctor, yes, we have supplementation as a tool. But I want to point out that supplementation to me is green medicine, which means that it's not meant to address all the root causes at all in some ways. It addresses some of the mechanisms better than medicine in some ways, sometimes worse. It depends. So sometimes medication is a better option. Sometimes supplementation is a better option. Both of them are still medication, meaning that they can deal mostly with the symptoms, but not necessarily all the root causes, which is why for me, it's really important to think through autoimmunity. I don't care what your diagnosis is, but what the hell is causing it? Which is why if you haven't watched my training on the 5 pillars of transform, I really go through from my own journey, my own experience on my training, the last 14 years of working on autoimmunity with thousands of clients, that there is a root cause approach to autoimmunity that's really key to stop the cause. Then you could stop playing whack-a-mole with all the symptoms, all right? That being said, what I'm going to say is my take on supplements is that you got to choose supplements with discernment. And what that means is that I want you to understand the why. Why do you need this particular supplement? And then how does it work? And why is it crucial? And if you don't need it, you don't need it. Okay. My job, if I do it correctly, is not to get anyone stuck on anyone's medications or supplementation for life, right? Is for you to actually, in our program, you can use data and training to have even more discernment. But I'm going to go through today just a couple of the key crucial ones that I think are indispensable no matter what your diagnosis is. And I'm going to go through why it's crucial in autoimmunity based on my experience, my opinion, with working with thousands over the last 10 years. What are some of the most important supplementation? Number 3, I'm going to say is going to be vitamin D. Okay. And vitamin D, we're going to be talking about today because it has so much data around it and it's so crucial in autoimmunity with all the data specifically for autoimmunity. I mean, we know that for cold, flu, viral viruses, the data, you've already seen it all over the media. But one of the things that's really key in my experience with autoimmunity is that it is key. And there's many reasons, right? And why one mechanism to think about it is that vitamin D is actually not a vitamin in a lot of ways. It's a hormone. It's a hormone. Okay. And those of you who've been through our Facebook group, seen all my trainings, know how I talk about the importance of hormones. Well, vitamin D is a hormone, of which nearly everyone is low in, especially if you live in the latitude of the United States. Okay. And vitamin D, you got to think about it as almost an on-off switch on every single cell of your body. So if you don't have enough vitamin D, that switch for energy production, healing, detoxification requires like the vitamin D switch to be on. So, which is why when you have low vitamin D, you see depression, you see fatigue, you see acne, like infections go crazy. You also see autoimmune flares go crazy. And it's a really simple solution because for me, like anybody that's living in the Northern Hemisphere, you should be on at least 5,000 IUs of vitamin D per day. Okay. That being said, how do you choose the right vitamin D for you? And this is where I want to teach you something. What I want to do is I want to actually teach you how to choose the right vitamin D, regardless of who you buy it from. Okay. And I hope that you guys know me well enough and have been in the group long enough to know that my goal is to provide valuable content. And in our programs, I'm teaching people discernment all the time. So my goal in this is to teach you some discernment. And if all you get out of this is not to buy the Costco brand or the Walgreens brand of vitamin D and to pick the right vitamin D, then I've done my job. There are multiple forms of vitamin D. I do love the vitamin D that is in our vitamin D, which is the D3. And I find that the D3 is a very active form versus D2, which is floating around the blood a lot. D3 really gets absorbed into the tissues and utilized. And don't you want the form that's utilized? So when you're looking at vitamin D here, a couple things is you want to look at the ingredients to say, is it the D3? I personally prefer D3 in dealing with an autoimmune population. Okay, so look for a vitamin D that's D3. Look for the units. We're looking at 5,000 IUs minimum is what people need with dealing with autoimmunity. And that's every single day. Okay. And then thirdly is vitamin D works much better with vitamin K. And vitamin K, I want you to have discernment around because vitamin K and the right form of activated vitamin K makes a huge difference. Okay. So when you think about vitamin K specifically, the vitamin K here is what I call MK7. Okay. And MK7 has unique properties in that certain forms of vitamin K actively, guess what it does? It can actually decrease the amount of calcium in blood vessels, which we don't want because that contributes to cardiovascular disease, heart attack, and stroke. You don't want calcium in your arteries. You do want calcium in your bones, right? And vitamin D helps work on bones as well to actually help build bone. So when you want MK7 to actually remove and not allow to decrease the amount of calcium in your arteries, but increase it in your bone. And that's why for me, it's really important to look for a D that has MK7 with it, which is what ours is. So for me, there's like really a million reasons why vitamin D is crucial in autoimmunity, and it's not expensive, right? It's actually the most inexpensive supplementation that you can do and is one that I do recommend for life, specifically because genetically, most people don't make enough vitamin D, at least not at the level that people with autoimmune disease need for proper autoimmune calming. So this is permanent. This one is permanent. Vitamin D, you always should be on a minimum 5,000 IUs a day. In our program, we actually go through what is proper testing for vitamin D. How do you adjust your levels? What are ideal levels for vitamin D? What are the functions of vitamin D with all the other hormones in your body? So we go through that in depth in our program. But I can tell you right now, anybody, any autoimmune disease, go ahead and start 5,000 IU of a D3 with a K in it, that's MK7, would be ideal.
Orsi, one of our alumni, she said before the program her levels were 31. Now it's at 75 after taking this vitamin D.
And that's really close to optimal. And unfortunately, a lot of doctors out there, Deborah is pointing this out, is that her doctor doesn't even know what to do to get the levels up more. You got to take more. But the other thing is, I see this happen all the time. There's like a myth around vitamin D, which is, oh, let's say the ideal is 80, 80, let's say. Someone gets them to 80, and the doctor says, okay, you can stop vitamin D now. I can go on and on about the lack of education of doctors out there around all the topics I'm talking about right now. At the end of this, you're going to know more about vitamin D than any of your conventional docs and even some of your functional docs. Because I can tell you right now, if you got you to an ideal dose, let's say you're targeting 60 or you're targeting 80, you got to that dose. Remember, I said that the level of vitamin D is genetically predetermined how much your body makes. So what happens if you stop at vitamin D? You're going to drop back to that low level again. And then they're like, oh, I wonder why it's low again. Okay. So this is really important. And these are really great questions, right? Another question I see is some people have better absorption with liquid vitamin D. Okay. Takes the high fat foods like avocado and magnesium. So what I'm going to tell you is this, is that vitamin D is a fat soluble vitamin. Our vitamin D is packaged in fat. basically to help with the absorption of that. So, which is why another key component is you really want vitamin D. It's already basically a liquid vitamin D that's in a capsule, making it easy to take. So for 5,000, you just have to take one tiny little capsule. A lot of drops are like 1,000. So you got to be like doing 5 drops. You are going to run through a little bottle of drops in like a week or 2. So the capsule is actually liquid vitamin D stored in bioavailable fat to make vitamin D absorbable and stable. Okay, so that's great point. Deborah says, my current dose is 50,000. I use weekly for 3 months. And this is another thing is people can get prescription vitamin D. That does not make it better at all. I'm just going to tell you, we have people in our program who's taking prescription vitamin D, and we actually will transition them over to taking vitamin D daily. Because you're going to get a better absorption and utilization in some ways. And the other thing is the vitamin D that is in the prescription doesn't contain the MK7. That's another thing. What happens is if you take a high dose of vitamin D, you're actually going to increase the demand for vitamin K to actually help move the calcium into bones. So what happens is if you take D without the K, you're actually leaching your body of like the K, and you're really causing a depletion of vitamin K. So even those on a prescription vitamin D, you got to get a D daily that has the MK7 in it. That's really going to help move that calcium from the blood vessels into your bone. So that's a great point about taking prescription vitamin D. Sunshine does help, Cindy says. That does help. Mushrooms, especially if you let mushrooms sit out in the sun for even half an hour, mushrooms naturally convert and activate vitamin D. So that's another way to naturally get vitamin D. But the other way to get vitamin D is actually fish. Okay. Fish actually is a good source of vitamin D, which is going to lead me to the next topic. I am going to talk about my number 2. We're going to lead into that. I do want to put up one bonus thing about vitamin D, which is that the vitamin D3 is actually the form of natural vitamin D in your body that is the most utilizable. Okay, so which is why I choose to have D3 in our product. Okay, so remember D3 and MK7 is the best combination, and you want 5,000 IUs a day. If you think that there's anybody that you know that could benefit from a training around supplementation and autoimmunity, go ahead and put their name in the comment section now, because sharing is caring. They may not listen to you, but they may listen to me. So go ahead and put their name in the comment section. That would be awesome.